So now we're going to switch focus and dive a little deeper into our projects. So I've asked each of the fellows here today to share a bit about a project that they've worked on so far as part of their fellowship experience. So I will turn the floor over to them as I set the scope of what these projects entail. So just as context, that we frame our projects, let's say, as design challenges. These are really an opportunity for fellows, as I mentioned, in both tracks to work on real world projects with real community and industry partners. We frame these challenges as how might we question. So you'll see that within each of the examples. There are mentors who range from campus faculty, industry or community partners, or an honors fellow that really are able to mentor teams and not only their teaming, but on their project in the content specific area. Typically teams run from 4 to 8 fellows and are really designed to be interdisciplinary. So from several different majors with several different skill sets, with that in mind, that not everyone is expected or should have every skill set needed to really tackle this really diverse and challenging project, but that you really are able to rely on the expertise of your team in order to step up. The solution, your team's proposal that you'll create after research, ideation, and testing, and really the timeline of these projects ranges from 4 to 5 weeks to basically 14, a whole semester. So kicking off, we'll have Emma first speak to her project.
So this project was our second design challenge of the past fall semester. And the question we were posed was, how might we reduce student isolation and loneliness amidst the COVID-19 pandemic? And our partner for this was UC Berkeley, but more specifically, the Vice Chancellor for Undergraduate Education. And so we worked really closely with a project manager who works in that chancellor's office, who really was trying to source more synthesis of the research that came from, you probably saw it in like your Cal Central, the Pulse surveys and a bunch of other surveys and things that the school has for gauging how students are doing. And they kind of came to us saying, we have all this data, but we don't really know exactly what to do with it to make an impactful change. And so what my team did, there's a picture of us all on Zoom. On the bottom, you can see, so we were all remote, but we interviewed a bunch of students and professors and advisors and upper level faculty and all kinds of administrators to kind of get a really holistic picture of what was going on. And the solution we came up with was to completely revamp the platform on which our student-to-student peer counseling organization, which is pre-existing on campus, how they operate virtually, and then also work to get them accredited via TANG to help with the overload that CAPS, which is Counseling and Psychological Services, is currently facing, because a big pain point we found was that a lot of students, even when they would reach out for support and help, would be faced with a month or two wait time before they could even get that. And then we also, there's not a picture of it on here, but concurrently to support staff and also bridge the gap between how students and staff were feeling that each other were not understanding how hard the other was working, created a professor toolkit, which is an online interface, including student testimonies and resources for promoting public health in a virtual class, or public health, mental health in a personal classroom, in a remote classroom, and also just different ways to connect students with the resources that they need.
Awesome, thanks, Emma. And Christian, if you wouldn't mind sharing about your project as well.
Yeah, of course. So this was actually our first design challenge of fall semester, and it was about telehealth and a little bit of background about telehealth. Telehealth is the distribution of health-related services and information via electronic information and telecommunication technology. So audio, video, phone call. If you've been part of the Tank Center, you know that's how we operate a little bit now because due to the pandemic, we're trying to keep the safest and being able to have equitable and accessible healthcare. So our design question was how might we use telehealth to improve equity and access for patients and physicians? And something that I really love about the Fung Fellowship is just that these these design challenges questions are super broad. And so what that does, that encouraged us as a group member, and it allows us to take full like agency on like which direction we want to take in our solution process. And so for this, we really found that we wanted to choose a population that was non-English speaking and elderly as well. And the reason for that is because we felt like there's a lack of digital fluency among this population, and that obviously impedes their equity and access to health. And so that was something that we were really passionate about. We were able to interview Dr. Gonzalez from UC Davis and some doctors and physicians from UC San Diego as well to give us a little bit of the insight of the physician perspective. And we also were able to talk to some community members who are non-English speaking. We had some interviews that are purely in Spanish. And so that was really enlightening because we were able to get a little bit more of that perspective and really make our tagline was actually like centralized and personalized healthcare through the ways of telehealth that can allow. And so that was something that we're really passionate about and super excited for when we were looking into the design solutions. And some of the solutions that we came up with was community outreach efforts. So finding local orgs around the Bay Area to see what they can provide to help bridge that gap a little bit. So we found a local org in Oakland that would provide free tech support services for our population. And we were also able to suggest a training program for physicians as well. And that would include technological support, inclusion, and how to go about talking to these different populations that may be different from them, and also connecting them to a translator network via provider. So what that means is that a lot of those who do not speak English, we are able to connect them with a network that is actually able to translate throughout the appointments. And that was really great. And our partner was, there were some representatives from PIH and Kaiser Permanente there, but Dr. Kingsta was one of the main partners for our project for this. And up there in like the right top corner, we did a little like design model of like representing like the barriers that this vulnerable group would go through. So digital navigation, language, etc. And then how can we bridge that gap to reach telehealth for everyone? And yeah.
Wonderful. Thanks so much, Christian. And now shifting to our conservation plus tech projects and two examples from this past semester. So Nikita, if you want to start us off.
Yeah, so one of the projects I got to work on in the conservation track was involving Belize, and that was kind of cool because it was a global project. So our question was, how might we co-create sustainable income opportunities that decrease human-based pressure on wildlife species and mitigate biodiversity loss as well as threats to human health and livelihood? So basically our question in a nutshell was, how do we create alternative livelihoods for people who depend on gillnet fishing, which was a very invasive type of fishing that destroyed the ecosystems of Belize. And so our partner was Mar Alliance, which is again a global organization that works to do different projects in sustainability in the ocean. And when we created our solution, we really wanted to focus on getting to know the community and creating a solution so that we could work with the community rather than just putting a solution on them. And so by doing that, we created a community science approach. So that was kind of empowering the community members and the fishers to be involved in the research that's going on in their oceans. And the one way that we came up with how they could be involved was creating a device that detected the changes in ambient water sounds to see where possible illegal fishing could be happening, because illegal fishers are another big proponent of gillnet fishing in Belize. We also wanted to work on educating the younger generation as well as educating the fishers on sustainability efforts and why the impact of gillnet fishing is so bad for the future. And to make sure that we had good communication with the fishery coalitions, we were able to contact a past Fung Fellow that was from Belize and had siblings that worked as gillnet fishers there. And that was an interesting take and definitely got us to have more exposure to what people in Belize were thinking themselves.
Wonderful. Thanks, Nikita. And then we'll round out with Ava, last but not least. Excited to hear about your project.
So in this was my first design challenge project in fall, and we've dove into the implications of agriculture and fertilizer use on soil health. So we worked with Save Our Soil, which is an NGO whose goal is to raise consumer awareness about the importance of soil. The question that we were answering was, how might we use technology to connect farmers and raise awareness on the environmental impacts of fertilizer? So we met with a soil scientist, we met with farmers in the community, and we decided to take a grassroots community-based solution that connected farmers using physical calendars, a Facebook group, and a centralized website. So our goal was to create an expanded community where farmers could communicate and engage freely with one another and share information on eco-friendly tips and tricks. When we did our background research, we found out that they didn't have a great way of sharing information. So our calendar drives traffic to our website and Facebook groups using the power of storytelling and personal experiences to showcase how farmers have incorporated eco-friendly practices into their farming. We were able to create a one-stop shop with the accessible information on the negative impacts of inorganic farming and with updated USDA guidelines for organic farming. We decided to offer the calendar and website in multiple languages in order to reach a wider audience. And yeah, this was my first time utilizing the human-centered design skills. So my group devoted a lot of time to learning about the farming communities in order to design a solution that was most practical and effective for them.
Awesome. Thanks for sharing.